The Ministry of Health says it can't yet confirm whether the Omicron variant is a community transmission. But epidemiologist Dr Avery Hinds is urging the population to take all necessary precautions since, according to him, this variant spreads very quickly. Sunil Lalla reports.
We don't yet have evidence of established community spread at this point in time, but we continue to monitor.
On Sunday, the Health Ministry confirmed there were 2 additional cases of the Omicron variant in this country, taking the total to 5. And although one of the patients had no recent travel history or known contact with another positive COVID-19 case, epidemiologist Dr Avery Hinds says it's still too early to say that the variant of concern is at established community spread.
Now, that would suggest that they're not sure where they picked up this particular infection, and there may be other individuals. But at this point, we can't yet confidently state that there is established community transmission, but we will be continuing to look out because, as we know, the potential for that particular variant to spread very quickly is very high.
Meanwhile, Health Minister Terence Dialsing says government's move to expand the creation of safe zones to government offices and state enterprises is to guard against the imminent threat of the Omicron variant.
This is basically a life-saving mechanism. It is not meant to punish anyone because we can't go on reporting 30 deaths a day. You realize 30 deaths a day no longer impacts on the population?
He adds that additional vaccine sites would be added in the new year, which is meant especially for those public sector workers.
And then we'll be ramping up at that time. It doesn't make sense to add sites now because those sites will be grossly underutilized and we simply don't have the human capacity at this point in time.
Mr. Dialsing notes that many, including the business community, have come out in support of government's move to insist that public sector workers get vaccinated and reiterates that it is not a mandatory vaccine program. Sunil Lalla, TTT News.